Hello everybody, I'm Dr. Francesca D'Arcangelo from Padua University Hospital, and I am the first author of the paper entitled The Impact of Sarcopenia on the Outcome of Patients with Cirrhosis with and without hepatocellular carcinoma who undergo liver transplantation, which was recently published in Hepatoma Research. Sarcopenia, defined as the generalized loss of skeletal muscle, mass, strength, and function, is a common complication in patients with cirrhosis awaiting liver transplantation. Previous studies analyzed the impact of sarcopenia on the outcome of patients with cirrhosis who undergo liver transplantation. However, most of them have included heterogeneous cohort of patients with no adjustment per severity of cirrhosis or indication for transplantation. Therefore, we sought to determine the prevalence and the impact of pre-healthy sarcopenia on morbidity and mortality after liver transplantation in a cohort of patients with cirrhosis with and without hepatocellular carcinoma. All adult patients with cirrhosis with and without hepatocellular carcinoma who underwent liver transplantation between 2010 and 2016 at Padua University Hospital were retrospectively evaluated. Presence of sarcopenia was assessed by evaluating abdominal CT scan within 6 months before liver transplantation, which is currently considered the gold standard in patients with cirrhosis, due to objective and reproducible measurements. Cross-sectional muscle area, highlighted in green in the picture, was then divided per patient's height to calculate the skeletal muscle index. Among different CT scores that can be used to assess sarcopenia, we specifically choose L3 SME because of its good correlation with whole body skeletal muscle mass. Standardized cutoff of skeletal muscle index were finally used to define sarcopenia. 197 patients were finally included. 77% were male. Overall, the most common etiology for cirrhosis was hepatitis C virus infection, followed by alcoholic and combined HCV plus alcoholic liver disease. In approximately 70% of these patients, hepatocellular carcinoma was the indication for liver transplantation. In our study, post-transplant survival was comparable in patients with sarcopenia, here in green line, versus patients without sarcopenia, here in blue line. However, when the analysis was adjusted per severity of cirrhosis, we found that patients with decompensated cirrhosis and sarcopenia had a significantly lower survival than controls with decompensated cirrhosis but without sarcopenia. On the other hand, in compensated patients, sarcopenia was not associated with a reduced survival after transplantation. Since the majority of patients included in our analysis had hepatocellular carcinoma, we also sought to determine the role of sarcopenia in this patient's population. Overall survival was comparable in patients with sarcopenia, here in green line, versus people without sarcopenia in blue line. When the analysis was adjusted according to Milan criteria, sarcopenia was associated with reduced survival only in patients with hepatocellular carcinoma beyond the Milan criteria. In conclusion, sarcopenia is a frequent complication in patients with cirrhosis awaiting liver transplantation. In patients transplanted for decompensated cirrhosis, sarcopenia is associated with a significantly reduced post-transplant survival. The assessment of sarcopenia in liver transplant candidates, as well as its proactive treatment, may improve recipients' outcome and should be considered in all patients with cirrhosis awaiting transplantation, particularly in those who are decompensated.